My name is Andrea Holman. I am a psychologist who serves as associate professor at Huston-Tillotson University, and was honored to serve as one of the chairs for the health and wellness working group for the task force. It was myself, and then also Dr. Mullen, who did have to step down from her role recently. She is the Associate Dean of Health Equity at UT Dell Medical School. So she and I really facilitated conversations and working times with at least a couple of dozen, if not more, members who really sought to have this kind of foundational goal that you see here, to look at the ways that institutional racism and systemic inequities have influence these social determinants of health. If you're not familiar with those things like healthcare access, education, neighborhood and environment status, economic stability, and the like. And so we wanted to look at how those things particularly manifest in the city of Austin, and how racism and inequities have shaped those in unfortunate ways. If you are thinking that this particular task about health and wellness is very large and broad and touches everything, well, you would be right. So one of our primary recommendations was to lean into just that, because of the social determinants of health, because they really touch on so many things, not just on the internal state of a human body, but the external state of an environment. We wanted to really adopt a health and all policies framework for the city of Austin, to look at ways that we can consider health in everything, because everything affects health. So as people create certain policies, procedures, institutions, review those, look at ways in which we can better include ideas around health access, health equity in those particular policies. That's really our overarching framework. And so hopefully the collective will do well to manifest that. We did have two other main recommendations. There are more. For the sake of time, we won't introduce those. But one of the bigger pieces was looking at and discussing, looking at the way in the state of health access in Austin, and then looking at a map of Austin. We started to see, as no surprise to many of you, some disparate levels of health access, and then also nutritional access. So one of the things that our working group wants to do is definitely increase healthcare facilities and services, particularly in the Eastern Crescent of the city of Austin, but then also looking at food. And these particular things some people refer to as food desert, where we want to increase the amount of accessibly priced foods, healthy foods, what's in the certain grocery stores that are even in the city and East Austin area, and then also increasing those actual institutions as well. So we want to do that, and then even furthermore, to create maybe a directory in various languages, of course, and various levels of access according to ability about those particular services in the area, so that people in that area can then look at one central document or entity to say, where can I go to access XYZ? Who can give me this service at this particular rate? So we wanted to do that. Another thing that came up in our work was the fact that as we create more and more healthcare professionals, we don't want to perpetuate the inequities and the oppression that already exists. So one of the main things that I was very passionate about, but also Dr. Mullen and several other of our working group members, was that we want to do two things: review and then also change what's going on in terms of education when we're talking about graduate work, and even in undergraduate work. When we're talking about the future psychologists, psychiatrists, health professionals, doctors, pediatricians, what are they learning and why about the people they're servicing? Challenging implicit bias, cultural responsiveness, getting access in terms of all different types of abilities, those type of things, and really honing in on ways that higher learning can improve or revamp cultural responsiveness. So with that, I think it's time for the next break.